Well, Deputy President David Mabuza has visited the Biovac Institute in Gauteng. The institute is a public-private partnership between the South African government and Biovac Consortium, which is focused on ensuring that the country has the required domestic capacity to respond to both local and regional vaccine needs. To speak to us about the vaccine rollout strategy is the Deputy Health Minister, Dr. Joe Phaahla. Mr. Phaahla, good evening, and thank you so much for your time then tonight. Firstly, when we look at the rate of the vaccine rollout and we do the numbers based on what we've been able to get done on a daily basis so far, it doesn't look like we're going to reach the target of 67% of the population by the end of this year.
Well, good evening, Kathy, and good evening to your viewers. Well, I think you may be omitting one point, the fact that according to the plan, by now we should be having a stock of over 1 million, which we would be vaccinating South Africans with. Unfortunately, due to the issue, as you know, of the incompatibility which was discovered during the trials of the AstraZeneca vaccine phase 3 trials, that it was not as much as it is effective in the original virus and also other variants in other parts of the world, but it was not effective with the South African-based variant. So that's really the premise from which we move, that we of course got destabilized by that situation. And but I must say that we're working around the clock to make sure that we can catch up, so that by the end of the year, that 67% of or 40 million will be reached.
With what is currently available in terms of doses, some of the numbers that have been done by experts say that 6,000 people are being vaccinated every single day. Now, just working on that number, because it's something that has been a deliverable, the pace of the rollout might be problematic. How is government going to ensure that that is increased to 200,000 people a day?
Well, remember that what we are working on now, it's basically having had to switch within a week from 100 million stock, which is in storage at Biovac, and now having to switch from that AstraZeneca within a week to acquire the doses from Johnson & Johnson. We had to work with them to bring in doses which were left unspent in various parts of the world, and that's a limited stock. But working with, I'll just give you an indication, for instance. Part of the reason why we, down the line, we are going to be able to accelerate, because we are trying to make sure that in the second quarter and third quarter of the year, we get largely the Johnson & Johnson vaccines, which are 1 dose, and unlike the others, which are 2 doses. So in terms of our discussions, even if we were to get half of that 40 million just to be Johnson & Johnson, and we're looking at more than that half, it means that at least half of the 40 million will not have to be repeated, whereas the others which we are still going to get through Pfizer and other producers like Sinopharm and the others, Moderna, sure, which needs 2 doses. Once you get mostly your 1 dose, it means that you are not coming back. Even those who are being vaccinated now, we are not going to go back to them. But so that already
even on that score, Minister, sorry for coming in there. Even on that score, when it comes to the actual rollout, you would still need to be vaccinating a high number of people on the day-to-day basis. And so, in as far as testing the current systems that have been put in place, when you're distributing 6,000 vaccines a day, it's going to be a significant jump from 6,000 to even 100,000 per day. And the question is whether or not the system is ready for that and prepared for that.
The system is ready. remember that, maybe just to remind you that, I mean, I know some of your colleagues, when we were with the DP, also asked the question about the fact that there's some criticism that we are saying we're rolling out when this is part of the research. Because of the nature of the doses we are using, proven that they are effective, proven that they are safe, and that's why it was just a matter of time to get regulatory registration. As we know now that the American FDA has already given emergency use authorization for Johnson & Johnson. Now, because of the restricted nature of the current vaccination, you can only vaccinate at specific sites. For instance, over the last 2 weeks, we're only using 17 to 18 sites because we have to restrict to sites which are authorized by the Medical Research Council as part of its research project. So at least one or twice, most of the provinces were just 2. Province big like Gauteng, 2 or 3, and then Western Cape, 3. So that was also restricting. But we have many more sites. Once we get out of this, we now move into full regulatory approval of Johnson & Johnson and Pfizer and all the others. We would be able to roll out that 200,000 in a day. That is possible in terms of our plans. So this is not a good model to can judge in terms of it is a good kind of dry run just in terms of making sure that, you know, these things can be done. But in terms of scale, it's a very small scale in terms of what we are ready for.
Let's take a look at what we have been warned might happen, which is that a third wave could be looming, especially as we get closer to the winter months. What percentage of the population would need to be vaccinated by the time we get to June to avoid another catastrophic peak of the virus?
Well, ideally, one would say that if the projections are correct, and we must assume that in terms of our previous experience, those projections will probably happen. Now, ideally, one would have said that by the time we reach June, we should have done more than half of the population. But, you know, this is not all in our hands. You know that even countries which had done prepayments are struggling to get actual delivery.
Sorry to come in there, Mr. Phaahla. We're quickly running out of time. So if I understand you correctly, on any score, we're not going to be able to reach that target of 50% before June. But what size of the population right now, depending on the latest, based on the latest plans that the department is working on, will you be able to have inoculated?
Look, being very conservative, just on the very conservative, I would say we're hoping to be at least between 1/3 and half of the population, between 1/3 and half should be covered by the time we reach middle of June.
Right,
yeah, that's what we're looking at. Yes.
All right. Unfortunately, we're going to have to leave it there. We've run out of time. The Deputy Minister of Health, Dr. Joe Phaahla.